together, like I said, for several years. She helped train me. So one of the reasons that I had you on the show today is that a topic that's been really, really important to me and has really been on my mind and on the mind of all of our colleagues in healthcare is provider burnout. And I kind of recognize some of the symptoms that I was experiencing, and I wanted to talk to other people that were working in high acuity areas as well. So we're going to take a little trip down memory lane and kind of talk about working in the ICU together and what was good about it and what was bad about it, and really how it affected us emotionally.
Great.
So let's go all the way back to 2008. I had just started there. Let's say you'd been there, so bedside for 11 years. You'd probably been in the ICU for 3 or 4 years?
3.
By the time I got there?
Mm-hmm.
Yeah. What did you like best about working in the ICU?
Oh, there's so many things I loved about the unit. The collaboration with the physician teams, the amount of respect between different levels of care. There was just so much teamwork there. We're like one big, huge dysfunctional family because we're taking care of the sickest of the sick. And I'll be a little honest, a little guilty pleasure is there is a rush that comes from taking care of somebody who's very critically ill and keeping them alive and getting them healthy and getting them out the door.
Yeah, I hate to describe it as that, but you're so right. There's something amazing about helping to bring a patient back from such a, poor situation.
Yep.
And that's, what'd you find tough about it?
Well, after 11 years pre-COVID, it was a little bit easier to manage.
Mm-hmm.
Because we would get our time off. We didn't have to spend 4 or 5 shifts in the unit in PPE for COVID.
Wow.
The harder part was the last year for me.
Really?
And that's what really drove home my burnout. I would sit in my car and I would cry before my shift.
Oh.
And when that started happening, that was my red flag, that I needed to start exploring other options to utilize my skills and my bedside experience. And it broke my heart. But I realized that I was feeling hopeless.
Oh, wow.
And it was time for me to shift. I had to shift for my mental health, for the health of my marriage,
Yeah.
and even my other relationships.
Wow. Thank you for sharing that. I mean, that's incredible. Like, I really feel for everybody that was able to do that, and it had to be just emotionally draining, and just such a difficult thing to see.
It was surreal. In 33 years of healthcare, I've been a provider for 33 years. I've never seen anything the likes of the symptoms and how they presented, and just the amazement. Like, it was just like I couldn't believe it.
Yeah.
Because it's something you see in a movie.
Yeah.
It's not something you see when you walk in the front door of your place of employment.
Especially here in Denver, right?
Yeah.
And this, I want all of you guys to recognize and remember that Angie and I took care of the sickest of the sick in one of the underserved community hospitals in Denver where people were sick. So to hear you say, just seeing this was traumatizing,
Yeah.
that's massive. And regularly, an ICU nurse will work 3 12-hour shifts a week.
Yeah.
And so you might, work 3 days in a row and then have 3 or 4 days off. But you're telling me you guys were working 4 and 5 days straight?
At the peak, when all of this began in March of 2020, it was mandatory overtime.
Wow.
So we were doing mandatory overtime, and we weren't the only ones.
Yeah.
I want to be really clear on that. We were not the only ones because we didn't have the staff to accommodate the number of sick patients we had, and we actually took over another floor.
Wow.
And extended our ICU to another floor, and all during this time frame taking care of these very incredibly ill patients, we were training PCU and non-ICU nurses to be runners and help us and facilitate. At minimum, when we clustered our care for our COVID positive patients, you would gown up and you would go in and you would be in that room for anywhere between 45 minutes to an hour and a half to 2 hours. And if you were in the process of tubing or intubating a patient who was COVID positive, lining them, you would have to take breaks, and you could be in a room for 4 hours at a time, and that's not an exaggeration.
Wow. Again, I'm going to have some photographs of the PPE that we'd be wearing, and like I said, a lot of my colleagues in anesthesia were intubating these patients. I think did Denver Health develop like a rapid intubation team, or
Yes.
an airway securement team?
Yes, and anesthesia was part of that team.
Good. And that was one of the highest risk procedures, was intubating COVID positive patients. You know, imagine you're working in a room with, 4 or 6 other people?
Limited to 4.
Limited to 4?
Even during a core situation.
Wow. Where people's oxygenation is dropping faster than you've ever seen in your life, and you're really just scrambling to try and keep them alive, all while wearing plastic bags, essentially.
And goggles, and 2 pairs of gloves, and face shields.
And doing this for 12 hours plus 4 or 5 days a week. So that's what people were facing, and I just want that to be really transparent. I want people to understand the struggle that providers have been feeling this past year, and it's really like, it makes me tear up, because it's just hard. These are people that have dedicated their lives to helping others. And so thank you, a huge thank you to everybody that worked through this, honestly.
It was, during the pinnacle of this, I was seeing 2 trauma therapists twice a week.
Well, I'm glad that you were getting help, and you know, my concern is how many of our colleagues were not getting help?
A lot, because ICU nurses historically have a very stoic approach.
Yeah.
Because we do our job and we do it well. And we're not supposed to be the sad ones.
Right.
And COVID has challenged all levels.